science,
engineering,
medicine,
chemistry,
physics,
biology, humanities, cardiology,
computing, public health, global
science communication.
Hello everyone, I'm Gareth Mitchell, looking back on the year 2020 in this edition. Also today, Imperial's brand new Centre for Paediatrics and Child Health is officially now up and running. And Imperial gets great results at this year's Cybathlon, a bionic Olympics. Great athletes and great technology, including a wheelchair with a difference.
Unlike other wheelchairs, this is an electrical wheelchair that is a self-driving wheelchair to basically work out where the person wants to go based on how that person is looking at the world. So we're using eye tracking and then just takes you there. It works like a bit like magic, like mind reading.
Wow, we'll tell you all about that. And we're discussing healthier Christmas food for the festive season.
The Imperial College Podcast.
All right, now, if you're a regular, you'll know that we always start with a couple of our podcast team giving us a bit of news from around the college. However, as the year draws to a close, and for something a bit different, we've asked the podcast crew to recall one thing they've learned that's really stuck with them this year. First, Hayley Dunning.
One of the most interesting stories I covered this year was the discovery of a molecule called phosphine in the atmosphere of Venus, which Imperial researchers were involved in. On Earth, phosphine is only created during industrial processes or by life, raising the intriguing possibility of life in the clouds of Venus. The part that caught my attention, though, was where we find natural phosphine on Earth. As Dave Clements in Physics told me, it's found in pond slime, the intestinal fauna of badgers, and penguin guano.
So now you know. What a fascinating story that's been this year. And for now, the intrigue continues as other research questions the statistical basis for that phosphine result.
Did you know that you can make leather out of fungus? Researchers at Imperial found that the mycelium fungus, which grows into a matted mass of fungal threads, can be made into sheets that look and feel like real leather. The substitute might even be more eco-friendly than real leather and its plasticky alternatives.
That's Caroline Brogan with her fact of the year. Meanwhile, Justine Alford has done a lot of work on climate change and health this year.
One of the most surprising things I think I learned on the job this year was that climate change isn't just affecting our planet and our environment, but it's actually also affecting our mental health, both directly, for example, through rising temperatures, but also indirectly from the constant exposure to doom and gloom in the media. We don't know enough yet about this complicated relationship, but the good news is, if we work towards a greener future, then we can have healthier minds too. So really it's a win-win situation, and we can all play a role in bringing forward a healthier, more sustainable future.
And another way we can build a more sustainable future is by thinking twice before rushing out to buy new clothes. Kieran Brophy learned this about fast fashion, specifically about pairs of jeans.
Each pair of jeans uses more than 9,000 litres of water to make. And in 2018, more than 4.5 billion pairs of jeans were sold worldwide. So in that year alone, if you work it out, there would have been enough water for everyone on the planet to drink for that year, wait for it, 6 times over. Something to keep in mind the next time you go clothes shopping.
Did you know that 500,000 tonnes of tyre particles are produced every year in Europe alone? Every time a vehicle brakes, accelerates or turns a corner, the tyres wear down and tiny particles become airborne and can even end up in our waterways. One of the most interesting student innovations to come out of Imperial this year is the Tyre Collective, who are trying to tackle this invisible form of pollution. To do this, they've developed a device which attaches to the wheel to collect these harmful particles at their source.
That's Joanna Wilson. Meanwhile, Maxine Myers spent some of her year following the clinical academics at Imperial, seconded as volunteers to London hospital trusts as part of the response to COVID-19.
One particular story that really struck a chord with me was Dr. Rama Elmadies. She told a story of a married couple in their 70s who were admitted one after the other with COVID-19. She talked about how thrilled the team were when he was well enough to see his wife in hospital, and the joy of being able to discharge both of them together after 3 weeks on the ward. It's just an incredible, hopeful human story to tell. So I really enjoyed being able to bring those stories to life and to share it with the wider public.
Yes, it's been great to share some of the stories of hope alongside some of the less happy news this year. Well, finally, Ryan O'Hare looks to the future in dealing with viruses. Some of the standout research for him this year has been all to do with the environment in our airways and how that affects our likelihood of succumbing to respiratory infections.
Now, this involved a nasty bug called respiratory syncytial virus, or RSV. They found that if cells inside your nose and your throat are primed and ready to fight off bacteria, you're actually more likely to succumb to RSV infection. But people who don't have this type of bacteria-driven inflammation are far more likely just to shake off the virus. This is important because it can help us to understand why people respond differently to the same virus, and could maybe even lead to treatments which can block this pathway and protect us against RSV and other viruses like influenza and coronaviruses. But I like this story because it also hints at the delicate balance of our immune system and the trade-off our cells have to make to protect us. And I thought that was really interesting and quite elegant.
Our news team here at Imperial looking forward and also looking back on the year 2020. Well, now, we are launched. That was the triumphant tweet from Imperial's Centre for Paediatrics and Child Health as it officially started business recently. The mission to benefit present and future generations of children. And what a time to be launching in the midst of the pandemic, and when in 2020 a child still dies every 2 minutes from malaria. As the centre launched, Faculty of Medicine Communications Manager Genevieve Timmins caught up with the inaugural director, Professor Andy Bush.
Children's health is a really, really important subject. But paediatrics in college is split between a number of different departments. But we've got to have a focused voice for children within college. Children's research, advocacy for children, and education at undergraduate and postgraduate levels. So what we intend is that this centre will be the voice for children, and that everybody in college who is interested in paediatrics in any aspect will want to be part of that centre and that vision.
And so how is this centre at Imperial different from other centres, focused on paediatrics and child health research, centres in London and around the UK?
So I think the real strength of this centre is the fact that we're embracing paediatrics at super specialty level, in the community, at all levels, primary care, dealing in part, not exclusively, but mainly with common childhood conditions. One of the important strands is our relationship with the West London Children's Healthcare Alliance. This is a fantastic development, bringing together hospitals, getting rid of a sterile atmosphere of competition, but working together. We want to work closely with the NHS. If we're going to do translational research in children, we have to have our NHS colleagues as part of that. And indeed, there has been a rich tradition of close collaboration between academics and NHS clinicians in this sector for many, many years.
And you've touched on this already slightly, but which different areas of research are covered by the centre?
So we have strong research themes. There's infection, neonatal research, brain sciences, allergy and immunology, child psychiatry, a large number of different themes. The richness of Imperial paediatric research is really quite extraordinary.
And from your perspective, how would you say that the COVID-19 pandemic has impacted paediatric research and care in the UK? Do you think that it's created a shift in priorities?
Clearly, COVID has shifted the research agenda dramatically. One thing that has also happened has been that the care of children has been impacted, the clinical care. There's been rightly a huge focus on adult care, a lot of very, very sick adult patients. And so, for example, intensive care unit facilities have been diverted to adult care. And we need, as a centre, to make sure that we do not lose ground in terms of paediatric care. So, for example, last winter, before COVID, no COVID, the country actually ran out of intensive care unit beds for children. We've got to make sure that that doesn't happen again. We've got to advocate for children.
And just touching on what you were just talking about in terms of building future capacity in paediatric care, how is the centre helping to support paediatric education and training at Imperial and the partner NHS trusts?
Gareth Tudor-Williams, who's professor and an infectious disease specialist, he is also leading on education and takes an enormous interest in that. We've got to have a coherent educational programme, and COVID, of course, has changed this. And the whole pattern of medical learning for years has been, bedside teaching has been fundamental to it. And increasingly, we can't do that. We're all having to think again about delivery of the curriculum, delivery of education at all levels. And this is something the centre is going to take a very active role in, building on the efforts of many people before that.
And how is the centre hoping to work with children and the local community in West London moving forwards?
So we're going to build on the extraordinary work that Mando Watson, Bob Claver and others have been doing in terms of connecting care for children. They are actually going out, working in primary care, working with the primary care teams, seeing children in the community, reaching out to them and building relationships that can only be a good thing in terms of professionals working more closely together. A strong focus of the centre is poverty and deprivation, of which there's all too much in the White City. And we definitely also, a strong focus is helping every child to reach their potential.
So how can people find out more about the centre and how to get involved?
So we really want to hear from anybody who is keen and enthusiastic about children, whether research, teaching, working with children, any connection with children's health care in West London and Imperial. Go on the website. There's a very short, and I promise you it really is a very short form about joining, and come and join in. We're looking for people who are going to drive the centre forward and help us achieve our ambitions of working together, creating better services, better research, better teaching about children.
That's Andy Bush talking there to Genevieve Timmins. And now for one of our professors, the year 2020 ended on a competitive note, and a successful one at that. Here's Caroline Brogan.
As Professor in AI and Neuroscience at Imperial, Aldo Faisal's work exemplifies multidisciplinary research. He looks primarily at how the behaviours of both humans and artificial intelligence fit and work together. Last month, he led a team towards a silver medal in the Cybathlon, the so-called Bionic Olympics, where differently abled athletes compete using the latest in assistive technologies. Aldo, thank you for joining me. How did the Cybathlon go?
The Cybathlon went fantastic. We won again, just as 4 years ago, a medal. It's incredibly inspiring to see people who are paralyzed and couldn't walk cycling in a cycling race. And we do this through technology by which we can actually make them cycle on a cycling rig. We've raced against 50 other teams from all over the world, and we've won again a silver medal.
That's great. But it wasn't just the bike race, was it? There were two other categories that
we competed in a number of other categories. One was an arms prosthetics race. It's a bionic prosthetic, and so my colleague Dario Farina developed new ways of interfacing with the stump of the arm and basically reading out the intentions of the amputee's intended hand movements and translate them into hand movements. And another race we competed in was the wheelchair race. Unfortunately, in the end, literally minutes before the technical start of the race, we then had a technical problem that prevented us from actually racing. But the exciting thing about the wheelchair race is that unlike other wheelchairs, this is an electrical wheelchair that is a self-driving wheelchair. And here we're using the gaze-based interface that we already developed and raced in at the last Cybathlon 4 years ago to basically work out where the person wants to go based on how that person is looking at the world. So we're using eye tracking, and the wheelchair recognizes that and then just takes you there. It works like a bit like magic, like mind reading.
And so that must involve quite a bit of learning some new skills for these pilots. What kind of research have you done lately into sort of motor learning and how that's applied in the real world?
And so this is an area of research that we've been ramping up that we call real-world neuroscience. We can now measure people behavior in very high accuracy using wearables in the real world. And we can also measure their brain activity, literally do mobile brain imaging while they're acting in the real world. And so now we need to find something where we can study that, a task. And we picked playing pool billiard. So we picked pool billiards as a task where we wanted to study how do people learn to play pool billiards. And so we made them do these experiments where we tracked all the movements, we tracked the movement of the billiard cue, we tracked the movement of the ball, so all with very high accuracy. And so this gives us a lot of data that reflects on the mechanisms.
So what were the outcomes of this research into pool billiards learning?
So once we looked at the data, we found how their movement behavior, how the brain controlled the movement of the body while they were playing pool, became better in every single joint of the body, from the ankle and your foot all the way to how you were holding your head. Everything was improving towards the final goal of making that perfect pool shot. Actually, the brain learns holistically. Everything is improved to solve the task. And actually, that's very often what maybe makes the difference between an amateur and a professional, that they basically engage everything in it. So that's very important. The other thing we discovered, people learn how to do motor learning in more than one way. So when you're learning to do something, one thing you can do is you can try to do many things differently. And another way of learning is you take what you know and you adjust that. What we're finding here in our real-world experiment, that people do both in a complex task. They're simply different types of learners. Their brains are running, so to speak, different programs, softwares, to achieve the same goal. And that's very important, not just, of course, for learning sports, but also for rehabilitation. We need to personalize the way we train people.
Could this have applications in things like stroke and rehabilitation, like you mentioned earlier?
Yeah, I mean, we have actually a whole research program to use wearable sensors for measuring and predicting how people are doing and detect if they're deteriorating, but also make prognostics about how we could improve their rehabilitation training. So we call this the NOAA project because it's about getting people out of the flood of not being able to move.
You've recently been awarded quite an exciting fellowship, haven't you, Aldo?
Yes, indeed. That was the UKRI Turing AI Acceleration Fellowship. And so that's to focus on questions in artificial intelligence, and specifically in artificial intelligence as to how we can use AI to learn from human experts how to do things better. And one of the prime areas where we've done this is in the domain of medicine. So the focus is not on the patient, the focus is here on the doctors, because doctors make decisions, they act, they behave by intervening on the patient. So it's a bit like in pool billiard, where the doctor is the pool billiard player and the patient, so to speak, is the ball that they're shooting. And then we're learning the relationship between how your actions impact on the state of the patient. And so it's, again, an idea of closed loop. It's action, decisions, consequences of that action, reevaluating reactions. And if we have large databases of human decision making in the context in which the humans made these decisions, we can effectively distill the essence of that decision making strategy. And that's interesting. We're applying that in the domain of critical care, so intensive care units. And of course, all these expert strategies that we're sort of distilling from the experts, we call it skill distillation. We need to be able to make understandable, why does the AI now make this recommendation based upon having, learn from hundreds of experts how to do something. And that's important for any domain where human lives are at stake or at risk. And so the regulators will want to know that your AI doesn't go bonkers and act safe and reliably.
Aldo Faisal speaking there to Caroline Brogan. Well, finally, I have to confess, I'm already counting down the minutes until the best feed of the year for me, the almighty Christmas dinner. But the feast doesn't necessarily need to be a gluttonous, artery-clogging calorie fest or an assault on the health of the planet, as Hayley Dunning has been finding out from a dietitian here at Imperial.
My name is Aigul Dagbasi. I'm a registered dietitian, but also a final year PhD student working at the nutrition department of Imperial College London.
You started off as a dietitian. Now, what exactly does a dietitian do?
The title dietitian is protected by law, firstly. And dietitians are healthcare professionals that can assess, diagnose, and then provide advice on nutritional problems at an individual level based on individual needs, or we can provide advice at a public health level as well. And dietitians work in quite a lot of settings, typically in hospitals and private clinics, but also in catering, food industry, and like research myself.
What are you currently investigating?
So our research groups are interested in understanding how plant foods affect our gut bacteria and how this can affect our appetite control in the body and how this may change with the processing of plant foods. So for example, when peanuts are turned into peanut butter or like beans are turned into bean burgers, how this can change this whole interaction.
Now, it's nearly Christmas, so food is obviously on everyone's minds. But how can we make our holiday food delicious, but also potentially good for the planet as well?
That's a really good question. It's definitely a fine balance to, I think, enjoy Christmas, be with family who constantly wants to feed you, and be healthy and be good for the planet. And I think one of the best things that we can do is reduce food waste, because we tend to cook a lot of food during Christmas. And some of this goes to waste, and that's one of the worst things that we can do for the planet, I think. I know turkey is traditionally eaten during Christmas, so I'm not going to go and tell people not to do it if that's what they want to do. But they can buy their turkey from a local farm, make sure they support those farms instead of supporting other big industries that may not be supporting the environment. But also try and be healthy and eat some vegetables with our Christmas meal as well.
Now, if people did want to go plant-based for Christmas, do you have any recommendations, and are there any benefits to doing that?
So yeah, they can definitely try like a lentil and nut roast. That's definitely what's on my Christmas menu because I'm vegetarian, and they're delicious. So definitely give that a go. Even if it's like a side dish as a starter, I think people should give it a go and see if they like any nut roast, lentil roasts. And yeah, there is some benefits of following a plant-based diet in general, and the obvious one is because plant-based diets provide us with a lot of beans, pulses, vegetables, fruits, we tend to have a higher fibre intake from these diets, and the national surveys in England are showing that we're definitely not eating enough fibre. We're eating around 17, 18 grams when we should be eating 30, so we sort of need to be doubling it. So that's the obvious benefit, getting more fibre, which is good for our gut health, but also high fibre diet associated with lower risk of diseases such as like cardiovascular disease, diabetes and certain cancers. So that's the biggest obvious benefit, I would say.
Now, it's been quite a year, and I know a lot of people will be tempted to overindulge, especially at Christmas. But how can we make the best choices for ourselves over this time?
Over the lockdown, we did a lot of boredom eating, we did a lot of emotional eating. And like one of the problems with Christmas is it doesn't involve one day of overeating, which wouldn't be that much of a problem. But like we tend to overeat for almost a month. So I think one of my advice would be limiting the number of days that we're allowing ourselves to overeat. And on the actual Christmas day, again, making sure you eat loads of vegetables with your Christmas meal, because these are lower in calories, but they're also quite filling. Leaving the skins of potatoes, carrots, parsnips is possible to give us more fibre. And actually also being careful with the alcohol consumption of the day, because not only we tend to overeat while we drink, but there's quite a lot of calories in alcohol as well. So little things that we can do. And on the British Nutrition Foundation website, there's quite a lot of tips that we can do on Christmas Day to make sure we don't overeat.
So what's on your Christmas menu? You mentioned nut or lentil roasts, but any other goodies you could recommend?
I do a really good mushroom gravy instead of normal gravy. That's also on my menu. Usually half of my plate would be definitely just loads of veggies and roast potatoes. But yeah, nothing too interesting, to be honest with you.
Well, I mean, mushroom gravy sounds really interesting, actually. That's a good substitute. How long have you been vegetarian? Have you found lots of interesting substitutes for things?
Oh, I've been a vegetarian for like 7 years now. And yeah, like since I became a vegetarian, I started discovering new recipes, new meals and vegetables that I've never eaten before. And obviously growing up in a meat-eating family and society, when you change your diet, it's literally like learning to walk again sort of thing. You need to learn everything. But I really enjoyed it and I don't actually miss meat, so I'm quite happy.
That's good. That's inspiration for everyone. I guess a lot of people might take that on as a New Year's resolution as well, which would be a good way to start the new year, just with a little overindulgence at Christmas.
Yes.
Well, just a little. That's Igul Dagbasi speaking there to Hayley. And that's it for this edition and indeed for the year 2020. Thanks so much for being with us over this last year. And who knows what next year is going to bring, but whatever does happen, we will report on it for you. Have a very splendid and a very safe Christmas and a prosperous new year, folks. And we will see you there in 2021. From me, Gareth Mitchell, and all of us on the podcast team, happy Christmas and thanks for listening. Bye-bye.